Okay, we're just 1 minute past 11 o'clock, so we're going to go ahead and get started. We may hear a few more beeps as people join in, but welcome. My name is Tracy Webb. I'm the Outreach Manager here at MiHIN. I'll be your host for today's edition of the download, joined by my trusty sidekick, Brian Mack, who's going to be your chat moderator.
Good morning, everybody.
So before we get started, I'll just go over a couple of items. The session is being recorded and will be available after this session on the MiHIN website. All attendees will be muted. If you have questions throughout the presentation, please feel free to drop them into the chat. A moderator will read your question aloud, or the presenters may also be responding to your questions within the chat itself. So keep an eye on that. The chat controls in the bottom right-hand corner of your screen. So go ahead and submit those questions as we move through here, and we will be sure to answer those. We've got some time allocated at the end of the presentation to answer any questions that don't get responded to directly in the chat. And if for some reason we need to follow up with any questions that we might not have answers to at the time, we'll be sure to send those out to the group after the presentation. So for any of you that might be new today to the download, MiHIN is Michigan's initiative to continuously improve healthcare quality, efficiency, and patient safety by promoting secure electronic exchange of health information. We represent a growing network of public and private organizations working to overcome data sharing barriers, reduce costs, and advance the health of Michigan's population. We have 5 key focus areas here at MiHIN: convening people to figure out functional solutions, champion statewide use cases to fairly get data flowing and keep it moving securely among all legitimate parties, operate as a shared service, relationships, active care relationships, security, legal, client matching, etc. As the behind-the-scenes infrastructure. We provide tools to support daily workflows and coordination, and we participate with reporting, conformance, and analytics from data lakes and longitudinal health records. Today's agenda will be the welcome, followed by an overview of the care coordinators ID progress as part of our coordinating the care coordinators project. That discussion will be led by Sammy Madsen-Olson, followed by Jason Vismaro, who will be giving a recap of our first imaging workshop series, which occurred just last week. Then we'll go through some closing announcements and go through any questions. So with that, I'm going to go ahead and hand it over to Sammy Madsen-Olson, who will give us an overview of the coordinating the care coordinators ID progress. Sammy?
Great, thanks, Tracy. Can you confirm that you can hear me?
Yep, we can hear you great, Sammy. Thank you.
Great, thanks so much. And thank you, everybody, for being here. I'm really excited about this opportunity to tell you a little bit about the progress that we've been making with our Coordinating the Care Coordinators project. Next slide, please. So today what we're going to cover is really briefly what is Coordinating the Care Coordinators, or CCC, a little bit less of a mouthful that way. Who can participate moving forward? What's the value to an organization, and how do you participate? So really excited about this. We can go ahead and switch to the next slide and get started. All right. So a little bit of background. Through a series of workshops that MiHIN undertook in, I think, the 2017-2018 timeframe, we did a lot of thinking with our stakeholders about coordination of care. What does it mean? How can MiHIN support care coordinators? And sort of what does the future look like there? Through those workshops, we were able to come to a multi-stakeholder definition and people contributed from across the state on this, and you can see that definition right here. So we define coordination of care as monitoring a person's goals, needs, and preferences, acting as the communication link between two or more participants concerned with a person's health and wellness, organizing and facilitating care activities and promoting self-management by advocating for, empowering, and educating a person, and ensuring safe, appropriate, non-duplicative, and effective integrated care. So this definition, we see it as applying to a bunch of different roles across the healthcare community, even folks whose name or whose title isn't necessarily care coordinators. And the new technology that I'm about to share with you is something that MiHIN developed because we recognize that care coordinators haven't always been included in our and when I say our, I mean the greater healthcare community in the health IT developments that have been such a boon to providers and other folks. So we're really looking for ways to get coordinators sort of into the fold and put them in a position where they can leverage some of MiHIN services. We can go ahead and switch to the next slide. Thank you. So how we're doing that is by basically creating a care coordinator ID. So with this new functionality, you can send us a form with all of your care coordinators listed, and MiHIN will assign an ID for those people. And that allows them to register in our health directory and declare active care relationships of their own. We've also added care coordinators as a designation in our health directory, and this means that care coordinators who are already in the health directory because they have an NPI, but maybe were erroneously listed as a provider or something like that, those can be updated to care coordinators and their listings are more accurate and better information is flowing. Next slide, please. So what can you do with coordinating the care coordinators? Health directory is now going to be able to show individuals as care coordinators who may not be considered a traditional provider with a national provider identifier. That's the NPI that I mentioned earlier. Health directory is also going to capture some supporting details that will help us clarify sort of the specific roles and functions that a care coordinator plays on a patient's team. And additionally, the Active Care Relationship Service, or ACRS, will now allow care coordinators to declare their own active care relationships, again, without requiring that NPI for the individual. Next slide, please. Thank you. So who counts as a care coordinator in this scope of work? Well, a person can be classified as a care coordinator in our system if they meet any of these criteria below, even if they have an NPI. So they identify their role on a patient's care team as any of the following. So case manager, care manager, patient navigator, health coach, community health worker, peer support specialist, things like that. Or if they identify their function on a patient's care team as completing needs assessments, addressing long-term needs or immediate needs, managing care transitions, or helping with public health emergency coordination. And then lastly, they could also qualify as a care coordinator if they don't meet the criteria in 1 and 2 above, but they do provide some sort of care coordination to their patients as defined in that multi-stakeholder definition that I covered earlier. Next slide, please. So how to participate is actually extremely easy, especially for folks who are already part of an organization that participates in MiHIN's core use cases. Next slide. I'll go over technical onboarding and then I'll tell you a little bit about the legal onboarding. But like I said, it's quite simple. First step is let us know you're interested. You can either contact help@mihin.org for more information, or you can contact your account executive if you have one. They should be able to provide you more information or direct you to someone who can. and they can also start the onboarding process for you. Second step, you're going to be provided with something that we're calling a batch enrollment form. It's a fairly simple Excel form. You fill it out, one line for each care coordinator that you want to register, and then send that back to us. At that point, we're going to load that batch enrollment form into our health directory. That's going to put those care coordinators in our health directory and make sure that they have a listing. We're also going to then provide you with care coordinator IDs, and those are just a string of digits. They're unique, and those can be used in place of an NPI for MiHIN's purposes. And then the last step is just participating in MiHIN use cases. Once you're onboarded, coordinators can start to receive messages and do many of the things that other providers do. Next slide, please. Thank you. So as you can see here, the legal requirements are pretty basic in terms of MiHIN. So we have the sort of typical paperwork that you need, that SDSOA and the MUCA, Master Use Case Agreement, and then our three sort of core use cases that allow everything to work. That'd be the health directory, the active care relationship service, and the ADT use case. Next slide, please. So the batch enrollment form. This is that form that you would fill out, one row for each of your care coordinators, and we provide you back with those care coordinator IDs. What you see on the screen is all of the information that you have to provide. This is it. Some really basic demographic information, first name, last name, email, organization name, and OID. And then you're going to see some additional fields that are encouraged. Those are basically more information to help us make the health directory listing as useful and actionable as possible. We're going to see healthcare field, healthcare setting. What's your care coordinator role? What are your functions? Next slide, please. And here you can see an example of one of those filled out. You can see there's two different care coordinators on this file. One of them happens to already have an NPI, so that has been listed. The second person does not have an NPI, and so that cell is blank. That's the third column. When we send back the form, the batch enrollment form, both of those will have something populated. That second person will have their care coordinator ID in that field. And then you can see as examples for the area of medicine, we see adult pediatrics, healthcare field, long-term care services, et cetera. So these are pieces of information that are going to be really beneficial in terms of understanding the care coordinator's specific functions. Next slide, please. And right here, you're just seeing that new unique identifier. The resource who did not have a NPI in the previous slide, this is what that care coordinator ID looks like that we assign. Next slide, please. And then this is just a little bit of information about how this interacts with your ACRES file. I won't go into it too much, but essentially that care coordinator ID is just plopped in the column that has the provider NPI or the attributed physician NPI, depending on the type of ACRES file. Next slide. And that's it. Like I said, this is pretty simple. It doesn't take too long. It's a pretty low effort item, and it gives your care coordinators access to a whole bunch of tools that they might not have before, particularly those ADT messages and declaring active care relationship service. We have gone through a bit of a pilot with this already, and we've been very pleased to work with Michigan Medicine and Greater Flint Health Coalition, which is a community-based organization, to assign their care coordinators IDs. At this time, I believe we've assigned around 120 of them, and we're very excited to continue engaging with our stakeholders and provide this service to more and more people. So thank you so much. I'll answer questions in the chat. I believe that Jason is our next presenter.
Thanks so much, Sammy. What a great presentation, great progress. I'm super excited for this work. And yeah, I do see a couple of questions coming into the chat, Sammy, so if you're able to answer some of those in the chat, that's great. We'll also hold some time for the end of the presentation to go over any of those that don't get answered in the chat. All right, with that, we're going to call the recap of the workshop series, session 1. Jason?
Thank you, Tracy. Thank you, Sammy. Good morning, everyone. My name is Jason Bismar. I'm a product marketing manager here at MiHIN over our imaging product. And I wanted to make sure we got a chance to talk with everyone about the imaging workshop series that just kicked off last week and going over some of the upcoming workshops that we will continue to have for this entire series. Next slide. The purpose of the workshop is really around a couple of things following our traditional MiHIN use case factory process. So really taking the outcome of the workshop to help frame what a statewide data sharing scenario might look like for exchanging medical images. Looking around to see what the key barriers are in image sharing so that we can make sure we can address those with any future enhancements to our use case. And looking at the different data sharing scenarios that are coming out of the workshop and prioritizing those so we're actually meeting the immediate value needs and also moving towards those long-term goals. And based on all of that, creating a white paper that frames the data sharing opportunity, the associated issues, and really going into the prioritization of what all those look like, and something that we can use to help frame what that, if there's any additional development that we need to do to enhance our existing use case, or whatever that next actionable step looks like in order to best meet the needs of everybody throughout the state. Next slide. In our first workshop, we had a fairly wide range of participants. You can see the majority of the participants were from the health systems, and then numerous others from the physician organizations, health plans, and HIEs, and some others that were representing a couple of different types of organizations, just based on where they are. Definitely, as we go into the upcoming workshops, we'll continue to look to expand the participation. So if you were not able to attend the first workshop, definitely it's not too late. We want to continue to make sure that everyone's engaged and allowing you to provide feedback however possible. All right, next slide. During the first workshop, there was a couple of main topics that we went through. There was some interactive polls that we had that walked through the challenges and some of the current barriers we're facing, and I have the results of those here on some of the upcoming slides, as well as looking at the current imaging use case that we're doing today, so what's already been defined and how we're exchanging the radiology images and attaching those into the ORU messages that are associated with the radiology reports. And those different aspects that we're actually doing today with just a couple of participants. Dr. Buckwalter from Michigan Medicine walked through the affiliate image transfer project that they have and some of the barriers and how they've been addressing that from Michigan Medicine. And then we had two vendors, eHealth Technologies and Philips, that presented their two different models for interoperability and how they move images at a more statewide and the interoperable level between all of the different facilities that they're connecting with today in some other states. Next slide. All right, so like I said, we had two audience polls that we really were focusing on for the first workshop and using this to really help us with the content for the next couple of workshops and ensuring that the feedback is being heard and actually framing these to start focusing in on what those data sharing scenarios look like. So we started with asking the participants what were some of the biggest challenges that the group was facing as it related to sharing images, both internally as well as with the other organizations throughout the state. So the biggest item that kept coming up, I think, throughout the entire workshop series is that just the different apps that are being used right now by the different outside facilities really have made it challenging to exchange the images between everyone. With those different apps, you often have various vendors and different protocols that they're all using to share the images with each of those other health systems that you're trying to receive or send images to. And then the disparate PAC system, so having, potentially a separate PAC system for your radiology images versus some of the other ologies was certainly another point that was brought up throughout. And then the providers utilizing the image exchange service actually did not have a lot of knowledge on how to use the service, often found it very difficult, and looking to see, where there are additional opportunities to enhance the training and make this more a part of their core workflow. And then our second audience poll on the next slide, it was really focusing around some of the feedback that those groups were getting today as it relates both to the patients and the provider side of things. So the current system that a lot of the facilities had in place was believed to be a little bit too complex, not easily able to find the images, not exactly something that they could do very quickly to retrieve those medical images for their patients and get the information they needed. Not all the hospitals are connected to a central service, so you have a few different services that those systems were trying to use. Not everybody's on there. It was very difficult to understand who might have images, what types of images they may have, and where to actually go and find those images throughout the state. And then from the patient side, a lot of the feedback that the group was hearing is really focused around the patients wanting more control of their images and the ability to direct transfers, especially in those scenarios where the patient, let's say, wants to go get a second opinion or, whatever that may be, where they want to take it to the specialist that they're most comfortable with. Allowing the patients to actually direct the transfers was something that they've heard quite often from those patients that are connected to them. Next slide. Some of the other key takeaways that are really going to help us with the upcoming workshops and making sure that we're incorporating these into the content. The ability to exchange images between those vendors is really going to be one of the focuses that we'll continue to dive deeper into and see how we can best address that. Knowing that depending on where you are, the setup that you have, there's really a lot of different options that is going to work best for you. And then at the statewide level, looking at how we can move the information and the images between each of those vendors so you can get the best of everything. One of those options that we started to dive into is looking at those key metadata elements on the image, including identifying the anatomical region of the image study was definitely something that was brought up as a high value add that could be implemented, and really looking at those metadata elements around the image so we can actually identify where those patients are and the types of images available. Kind of building on top of that, definitely want to keep diving into the possibility of a statewide index of imaging facilities, the types of images they have available and where you can go find them. And then there were some questions around the use of FHIR, and definitely continuing to wanting to dive into those FHIR standards around imaging and those studies, and making sure that whatever we're using or looking at for the query abilities, so you can actually go and retrieve the images. If there are opportunities that we can align with FHIR or with some of the integrating to healthcare enterprises or IG specifications for image exchange, continuing to go down those paths where we're using the more widely adopted interoperability standards for moving the images across the state. Right, next slide. There's a couple of additional upcoming workshops. So the first one is really focusing on the health systems and the imaging centers that are providing the images, what they're doing to send in some of the challenges they've written into. The next workshop is coming up here on February 25th, really focusing on the provider needs, the values that we can continue to provide through the service statewide for those clinicians that are reading and using the images. And then as well as the benefit to the patients that are, members of the organizations or, seeing the providers that you are participating in your services. So really trying to focus on that and diving into, what statewide scenarios we can define that are going to drive the most value to the end users that are getting the images. After that, really early on in April is what we're anticipating. The last 3 workshops, we haven't 100% finalized the dates, but pretty confident with the ones that we have up here. Really starting to dive into the health plan benefits and the benefits to those plans, as well as the, really starting to pinpoint on those technical interoperability approaches that we can use throughout the state for that use case, and the data flow on how we can best do that to meet the values that were identified throughout the first 2 workshops. A couple weeks after that, we're actually really going to start diving into the white paper that I mentioned earlier. So going through and actually starting to write out the draft of, what that data sharing scenario may look like, prioritizing if we have a couple of different things. So we're actually kind of, going through it in the correct order. And, something that we can really use to take through the additional channels after the workshop series, and leverage as we're going to build any additional enhancements to the use case, if there may be funding or whatever, we need to do to make sure that we can get this in place. Using that as the basis for that and that draft towards the end of April. And then at the end of May, taking all the feedback that we get from that April session and finalizing it, wrapping it up so that we can do the final review with the entire group at the end of May. Last slide. And like I said, if there's any questions, definitely feel free to reach out to myself. My email's there. You can also reach out to Tracy, and she knows how to get in touch with me, or, as always, the help at MiHIN.org. Definitely want to continue to increase the participation. So, like I was saying, if you were not able to make the first workshop, absolutely, it's not too late. We definitely want to continue to, make sure that everyone that has a stake in this is able to have their voice heard. And absolutely would like and encourage you guys to be able to participate in the upcoming series. And with that, if there are additional questions, you can also put them in the chat, and you'll answer as many as we can today as well.
Jason,
and up next,
for that.
I'm passing to Brian.
Thanks, Jason, for that recap of session 1. We will be, with our announcements, going through some information on how to get registered for that series for anyone who's interested. Brian, can I get a check-in from you to see how we're doing with questions that are coming up in chat?
You sure can. Sammy is doing some yeoman's work there. She has addressed all of the questions related to the CCC that have come in thus far, and I'm keeping track of those. No questions yet on Jason's presentation, but we are fully caught up. I can kind of go over some of the back and forth that Sammy has been having, if that is helpful. Otherwise, we are happy to address any questions offline that may come up as well. And just to recap, the question's been asked a couple of times. The slide deck and the video of today's download presentation will both be made available afterwards. So it'll be sent out to everybody who has participated and registered.
Yeah, thanks for reminding me of that. We typically get that out within just a couple of days after each download session. So we'll be sure to share with you the links on the website to get a hold of that and send any follow-ups to all of the folks that registered as well.
Hey, Tracy, a question has just come in for Jason. Jason, the question is for the imaging exchange. Has anyone taken into account the size of the images and what it could do to messages?
Yes, absolutely. So those real-time notifications, what really we're looking at the current use case is just adding a link where you can go find the image and making that much easier to find than having to sift through the 2 different systems that those typically go to, or allowing the direct transfer into the pack, so not having to bog down that real-time traffic and allowing you to download it through a back channel. Really focusing though on right now with just kind of letting you know there is the image and where you can go find it through the link.
Good question. Thanks, Jason. All right, I'm going to move on to some announcements then, and then Brian, we'll check you back in with you in just a couple of minutes if any other questions might have come up in the meantime. I want to just give a few reminders here. The interface, which Brian, correct me if I'm wrong, I believe went out yesterday. That's our monthly newsletter. You can also view it at mihin.org/the-interface. The next edition of the download will be on March at 11 a.m. And regarding the workshop series, I just wanted to a couple questions that have come up about this to me and in today's session too. The next session will be on, oh, looks like we forgot to add a 5 there. It will be February 26th. I'll correct that in the slides before we post it out to the group. It will be February 25th, excuse me, from 2:30 until 5 p.m. Please feel free to reach out to me if you'd like to learn more about it. There will be registration links, excuse me, will be registration links that are sent out for each session. So if you'd like to be added to the mailing list to receive that registration notification, feel free to send your name and email address on over to me at tracy.webb@mihin.org. You can also see more information as well as registration information for all of our events at mihin.org/events as well. So if you forget to get signed up or you're not signed up as is, feel free to check out that event on our website, and it will get you all of the information you need to get registered. I also want to just take just a second to talk about the MiHIN account executive team. The senior regional account executives are responsible for business development within their assigned territories. So we have Chris Ford covering mostly the western part of the state there in that orange section. Brian Bullock covering the central region of the state there in those green counties. And then Greg Kavanaugh covering the eastern portion of the state there in the purple sections. So they can always be a great starting point of contact if you have questions about any of our services or need any kind of assistance. They're really responsive and helpful in getting you connected to whoever you need. Also want to take a moment just to highlight our corporate account executives. They're responsible for enhancing the success of my customer partners through MiHIN use cases, solutions, and services. You can see their names and contact information there with their special areas of focus. So I'll pause here just a second in case anybody needs to jot those down. But again, we will be posting the deck out on the website after the presentation. And Brian, I want to give one more check-in on the chat to see how things are going there, if there are any other questions that have come up in the meantime.
We are in good shape, Tracy. No additional questions thus far. Sammy reminds everyone that she is available you can contact her directly by email at sammy.madsen-olson@mihin.org. If there are any additional questions on the CCC program, she's happy to address those directly as well.
That's great. And if possible, Sammy, if you want to just drop your email address in the chat. I'm not sure if you have done that already.
Yes, she did.
Oh, perfect. Okay, with that, we will see everyone on March 2nd. And in the meantime, please don't hesitate to reach out if you have any questions. You can always reach out to me or help@mihin.org or any of our presenters here today. if you have additional questions or need additional follow-up. Thanks again for joining us. Have a great day, and we'll see you March 2nd.